Melayu has a very rich of tradition and petua that we follow. Melayu has a very rich of tradition and petua that we follow. Your mom said, Sophia, put a Colgate on it. Sophia, put a turmeric on it. Sophia, put essential oil or minyak gamat or any oil that you have in the house to put over the wound. Okay, it's not actually that I want to say all those things doesn't have its benefit, but to put it directly on a wound is totally wrong, because we don't know what is the additional ingredient that they have that can hinder the healing process. So if you have a wound, it's better to run it under a tap water 5 to 10 minutes at least for the bleeding to stop. And then you can, if the wound is too big, then you have to seek a medical attention. If the wound is bleeding, you have to compress it, makes the bleeding stop, and then go to the clinic. If the wound is just a minor one, if you have a plaster at home, then you can cover it off. Say that we need to be on par with modern medicine and evidence-based medicine even in our home to make sure that our healing process becomes faster and proper.
I have one question regarding plasters.
Alright, sure.
So I've seen online they said if you have a wound, it's better to not cover with plaster because it slows down the healing process. Is that true?
Okay, actually it depends on what kind of wound that you have. Okay, the trick into healing a wound that they need a proper moisture balance. Okay, so if you put on a plaster on a wound, it actually makes the area a bit humidified, serves a very appropriate environment for the wound to heal. But if you let it too dry, kalau you perasan ada setengah luka kan, becomes a scab, and then you let it be, it will become a bit late to heal because you let the scabs to be there. So sometimes this plaster or this we can say dressing are actually one of the means or one of the treatment that you can use to make your heal go faster. It's as simple as you have an acne, Sophia. Okay, so sometimes acne, they have pus collection, right? So in the market, you have an acne patch or hydrocolloid patch. So that is one kind of plaster or dressing we can say. When you put on that kind of plaster on your acne, all your pus will accumulate, and then when you tore it off, you can see that there will be no injury to your acne. So it will leave your face flawless because you don't have a scar from the poking. Okay.
Okay. Thank you, Dr. Aida. So now we know that wound healing might seem simple on the outside, but on the inside, it's much more complex than that. So thank you for listening, and that's all from us.
Thank you.